So I assume everyone here is a doctor, at least have good understanding of anatomy, physiology, and biochemistry, because aesthetic medicine or rejuvenation, which we call in dermatology, requires you an understanding of anatomical aspects of the face. Okay, so in today's session, I, Dr. Bhanupriya, will be talking about a lot of things about non-surgical facial aesthetic modalities, mainly non-surgical one. Okay, and this is more towards the rejuvenation, reconstruction. Okay, and commonly practiced by someone who is skilled and competent in interventional dermatology. Okay, so even though it is a non-surgical, but it requires the skills of intervention and understanding of pharmacology to practice this. So this is art and science. Majority of time, the aesthetics or reconstruction or rejuvenation is sought by the people who have chronic dermatological conditions, who have deformities developed due to chronic inflammatory processes, or sometimes due to aesthetic or body dysmorphism disorders. Okay, so many times these people come to you. So why I am not using the word cosmetic? Because majority of time the clinical indications are these conditions rather than the cosmetic conditions. Okay, so when I talk about all of this, these non-surgical modalities, as we move, you will come to know these. You have been seeing these, has been discussed.
Facial aesthetics begins with understanding anatomy. Every face is unique, requiring a personalized assessment. This is done before selecting the treatment approach. Treatment planning focuses on skin health, facial harmony, collagen support, and natural enhancement using evidence-based medical principles. Successful facial aesthetics combines clinical expertise, patient safety, realistic expectations, and individualized care to achieve balanced.
A, or commonly here in India, we know it as a Botox injections. So, as a medical professional, you already know that the botulinum toxin, causes cellular cascade, where the protein which is there in the Botox toxin, okay, they mimics and bind the receptors in the cholinergic nerve terminals. Okay, then this toxin is going to produce the effect of paralysis. Okay, so this Botox toxin or botulinum toxin type A causes temporarily inhibition of the acetylcholine at the neuromuscular junction, NMJ, effectively inducing localized muscle relaxation. And this physiological response prevents the contraction of our targeted muscles, which is the primary cause of dynamic wrinkles formed by the expressions. Okay, so your Botox toxin or botulinum toxin type A is almost 150 kilodalton, because whenever you talk about the protein and whenever you will start seeing the ampules of it, you will see the constituent. So 150 kilodalton of protein of heavy chain, out of that 100 kilodalton is a heavy chain and 50 is a light chain. That combination you have to use, and this protein binds at our SV2 receptor, especially at the presynaptic levels, okay, in the cholinergic nerve terminal. So whenever it
Botulinum toxin works at the neuromuscular junction by temporarily blocking communication between motor nerves and targeted facial muscles. The toxin prevents acetylcholine release by cleaving snare proteins, interrupting nerve transmission and reducing temporary muscle contraction. As nerve activity gradually returns over several months, muscle function recovers, making repeat assessment essential before further treatment.